It's now my pleasure to introduce the first of our presenters today. Dr. Todd Otten is with us today representing Medicine Forward. Medicine Forward is disrupting how doctors organize one relationship at a time with their mission to stand up for what is sacred in medicine, the physician-patient relationship. By focusing on innovative solutions and collaborative efforts, Medicine Forward aims to improve patient outcomes, enhance healthcare delivery, and address the systemic challenges facing the medical community today. With a commitment to bringing together healthcare professionals, patients, and industry experts, they strive to create a more equitable, efficient, and effective healthcare system for all. So, Todd, welcome.
Thanks for having me. It's a pleasure to be here. I'm excited to chat about Medicine Forward, and I know we have a 15-minute clock. I see it up in the corner. So this is about the same as when I was seeing patients, complex congestive heart failure, depressed, can't afford their meds. I figure, and I'll document everything as we're going too. I'm just kidding. No, I'm a family physician, practiced for about 20 years before I stepped away, drawn a line in the sand. Many of you have seen this, but this is the book I co-authored with a patient. And essentially this book is turned into a key, which is really how I got involved with Medicine Forward. So enough about me. I'd like to focus on the organization because I think we're at a wonderful time currently. Medicine Forward was founded in 2020 by a handful of physicians, Eric Topol, Emily Silverman, Esther Chu, Brian Dixon, to name a few, and has had just some wonderful endeavors over the years. But in the last year, we've really gained some steam here. We've got about 400 members currently, and it's not just physicians. It is a bunch of like-minded, positive change agents that are assembling to cause quote unquote good trouble. Currently, I serve as the Chief Impact Officer. I joke in many circles that makes me the chief troublemaker, probably because I like to stretch boundaries, ask questions, and challenge the status quo. And that's what we're up to within Medicine Forward. So Lonnie and Denise were kind enough to give me a framework for this conversation. So I'm going to work through that. I only have about 37 pages of notes, so we should be able to cram all that into the next 13 minutes and 20 seconds or so. So the first part was purpose. And if you go back to the origin of Medicine Forward, it's really to restore the doctor-patient relationship, that sacred bond that has been eroded over the years, which can be extremely powerful, especially when it's done well, both ways, in fact. So we're moving beyond that, though. We're at a pivotal time with Medicine Forward where the inclusivity is becoming a key part of this. We realize that physicians can't accomplish all these changes on their own. And even in our core attraction team, it's about a 50-50 split of physicians and non-physicians. And to me, that's amazing. And I think that speaks to the power that is possible with one-to-one, so to speak, of the physician and the non-physician coming together for change. So that's really our purpose. Long-term, we're hoping to not only organize these change leaders, but accelerate the transformation. Gabe Charbonneau, who's one of the co-founders, who, forgive me for not mentioning you at the start, Gabe, clearly you're a key cog with our organization for sure. But he talks about a federation of change leaders. And that's really our vision long-term, is to organize and assemble those key individuals who want to make change going forward. So what's our vision? That's maybe the second part of this. We like to see our effort as a grassroots or a ground up change, get that groundswell to not just talking about the problems, but actually moving towards action. I like to say that we are hopefully a magnet for positive disruptors. Key word in there is positive, because you can cause disruption, but if you're not moving in a positive way, you're probably actually creating more problems than solutions, if you will. Again, I talked about inclusivity, and I think the importance there is really the power of the collective. There's only 1 million physicians plus or minus in the United States, but we have 330 million people in this country, of which the vast majority of them have some level of frustration with the current delivery of healthcare. If we can organize those voices and project those in certain directions, we are going to be very noisy and facilitate a lot of change. So amplification is definitely key. And that vision is not only short-term with the project that I'm going to share, but really long-term. We vision that Medicine Forward isn't going to be the one making all these changes, but in conjunction with what Lonnie and Denise are doing with the Healthcare Reinvention Collaborative, we can connect individuals, right? We can start to get away from the silos that exist, even with the people trying to facilitate change. There are so many wonderful people out there that I've found in the last year with this new part of my life. It's how do we connect those dots? how do we get John and Kathleen and Lonnie and Paul and everybody else on the same page so that when an initiative pops up, we can accelerate that and make it go quicker, if that makes sense. And actually, I'm dying to have Denise show a slide because I'm so excited about it, but we're not there yet. Just bear with me. Bear with me. I'll try to say something funny if I can to keep everyone's attention. So strategy, what are we working on currently? There's a handful of things. We've been working on our foundation, our infrastructure. It's gone from essentially just a few key individuals to a wonderful core group with our traction team, of which Denise is on that traction team. Ooh, and there it is. There it is. All right. I love it. Can everybody see this graphic here? Somebody give me a thumbs up or a hand, wave hand. Yes, perfect. What are we showing here? This is one of our short-term strategies. This is an audio documentary called Prescribe Hope. Prescribe Hope was born out of a conversation with Gabe Charbonneau, myself, and Matthew Zachary in New York City at the Burnout Symposium last November. Matthew is a brilliant podcaster and audio documentarian whose previous work was called The Cancer Mavericks, which had over 1 million downloads, over 1 million sets of ears, plus or minus, listen to his work. And so Matthew was very adamant that we needed to not just be doing advocacy work, but also activation, meaning leading towards actual change. Denise, actually, if you want to scroll down and show the verbiage here, if people want to read this while I'm blathering on, feel free. So this is what Medicine Forward is aspiring to in the very near future, to get this audio documentary funded, which is what you're seeing here, in production and then delivered before the end of the year. And we're not just talking about the problems within healthcare. We want to get safe haven or safe haven types initiatives in all 50 states as soon as possible. What does that mean? That's breaking down those barriers to mental health treatment resources, et cetera, for clinicians, top to bottom, physicians, nurses, nurse practitioners, pharmacists, everybody. Take out those barriers that are in credentialing language so people can get the treatment they need, so we don't have our colleagues dying by suicide. It breaks my heart every time I see another life lost for ridiculous reasons, and that's a big part of my why. So hopefully everybody's had a chance to see this. And here's my shameless plug that if you want to find a way to support us, this is a way to support us. Throw a few dollars at this project. I think it's going to be amazing. And I think it's going to help not just clinicians, but patients too. We think about the negative ripple effects when individuals are burned out and how that affects patients, how that affects colleagues, how that affects administration. We can't have that going on anymore. So I'll get off my soapbox and I'll get back to what I was talking about, which was strategy. So this is our number one short-term strategy. Long-term, we see additional initiatives similar to Prescribe Hope coming from that core nucleus within Medicine Forward, raising funds, et cetera. But going beyond that, we want to be a part of a network of networks, which is why we are thrilled with what Denise and Lonnie are doing with the Healthcare Reinvention Collaborative. It will streamline the opportunity to spread the word about initiatives such as Prescribe Hope. Perhaps people don't want to work on PBM legislation. Perhaps people want to work on prior auth legislation. I'm just one person, but if I can connect the right individuals, if I can connect Paul with the right person, or I'm looking at Deborah up in my window with the right group to get things started, this is how we can make change. Okay, I'm going back to my notes because I went off on my own little tangent. This is where I'm looking at the clock going, all right, Todd, you got 5 minutes. You got to document all this stuff. You got to call the social worker. You got to send the meds in, order all this stuff. Let's go back to what we were doing here. All right. So what are some of the barriers that we have faced? I think with along the lines of a lot of other nonprofits, we have a lot of energy. We have a lot of enthusiasm. Infrastructure and the foundation is so critical. And that's where, particularly as physicians, we need help. Like I know how to treat patients. I know how to write for medications. I stink at clerical stuff. I'm terrible at it. I need help with IT stuff. Our website needs overhaul. And these are the kinds of things that maybe there's somebody out there that wants to do this. And hey, I got a group that's looking for help. Sure, send them my way. We'd love to have it. So that's one barrier. But then like many of us, it's funding, right? Who's good at grant writing? How do we accelerate fundraising? And so one of the things that we're doing with this Prescribe Hope initiative is we've gamified it a little bit. We've set up some teams for fundraising to try and reach our goal. And so far, it's been kind of fun. Like I was in the lead yesterday with fundraising, probably because I was the one that turned it on and immediately texted a bunch of my friends to donate some money. And Many of them did. And then what did Gabe do? Gabe immediately came in with a higher donation, so he took the lead. And so I texted him, "Damn you, Gabe! Why did you do that?" But it makes it fun, right? And it makes it make you feel like you're doing something good, donating some money to a worthy cause. So those were two of our biggest obstacles to this point. But we're also finding strategies and solutions to overcome that. I do think it's important to maybe go through some of the principles from our website. I think these are key. And I'm not going to dive into these each one because we've got just about 3 minutes left, but I see a lot of value here. So for Medicine Forward, we build on a foundation of well-being and trust. So critical, so often missing in our healthcare space. We stand up for authentic human relationships. I will freely admit I show up to a lot of meetings looking like I just rolled out of bed or I'm wearing my pajamas, but that's just who I am. And if you don't like it, too bad. So there it is. We put humanistic patient care first. Enough said there. Not only do we bring physicians together, but I see us bringing a whole host of positive change agents together, which leads to we claim our power as change agents. Instead of having that learned helplessness together, if we band together correctly, we absolutely can and will be a powerful force. I believe that 100%. And we speak up for health equity. I was just on a call with a young lady in New York City who is doing mental health treatment, and she was lamenting on the struggles that they had. And immediately my mind went to the Healthcare Reinvention Collaborative. It went to Medicine Forward. How can we bring individuals like that into the fold to find other institutions that are having success in the areas that she's struggling and help her out with that instead of reinventing the wheel? Confront challenges with curiosity and innovation. This is a no-brainer to me. We have to think outside of the box. What is going on currently in so many institutions and areas is not working well. We have to think differently. We have to be unafraid to challenge the status quo. And occasionally, if you're with me, that'll be associated with expletives. Just I was in the Navy, you just have to deal with that. And I don't do it on purpose. It's just who I am. And I possibly have told other CEOs where I think they can go and how I think their ideas are. So it is what it is, right? But we can't be afraid, right? Like you tell me like, hey, this is how we've done it for 30 years. And I'm like, well, clearly that's not working because we're spending a ridiculous amount of money and have horrible outcomes. All right. So I think I've covered most of the questions without droning on, and hopefully we added a little bit of levity here. I know there's going to be time for a Q&A at the end, but I want to impart this to everybody. I'm doing what I'm doing because I'm sick of the frustrations of my colleagues and patients. And I believe that Medicine Forward and what Denise and Lonnie are doing with the Healthcare Reinvention Collaborative offers hope. And if we get nothing else out of this conversation today, it needs to be hope. Because if we can provide hope to one other person, we can create a ripple effect. And the next thing you know, we've started to move the needle. So with that, I will stop talking and mute myself. Thank you for having me. I'm actually on the cusp of starting a unique direct primary care model for a very forward-thinking emergency room physician group in Grand Rapids. And for those that aren't familiar with direct primary care, it's more of a direct contract between the clinician, physician, what have you, and your patient group. And you eliminate this whole layer of, pick what colorful adjective you'd like to put in there. I often say fat, that doesn't add value. And I think that could be a key part to a model that John speaks to eliminate a lot of the waste that currently exists in our infrastructure. So stay tuned with that. And I think the corollary to that is, as the person that's going to be leading this charge, I'm going to be looking for best prices for CAT scans and imaging and what have you, and reaching out directly to some of those entities within the area I'm going to be working. So it's a fascinating part of what I think could be a solution to our existing cost issues. So I'll stop on that. Denise, did you have another
question? Well, and you actually queued up what I was going to ask in regards to what Medicine Forward or yourself might be doing similarly to what John and Kathleen are talking about, and how there's correlation or integration to the work that medicine focused efforts might have with nursing. And so direct primary care is one of those that comes to mind.
Well, for sure. And I think, one of the things that we'd like to do within Medicine Forward, and Gabe can piggyback on this too, is, again, we're not going to be the ones to have the answers for everything, but we feel like we could be a repository where if we have different individuals that are interested in perhaps direct primary care, point them to other institutions that are doing that, like the DPC Alliance or I think Docs for Patient Care is another group out there. Right. And you start to get these ideas filtered out to the greater masses. And all of a sudden, all these dollars aren't going to the the Bahukas or whatever we call it, the big insurance companies for those that. So yeah, that's where I think entities like what the Healthcare Reinvention Collaborative are doing, as well as Medicine Forward are doing. And it marries well nicely with what John's doing.
And Gabe, I see you just dropped that image of the mission for Medicine Forward, which is to stand up for what is sacred in medicine, our relationships with our patients. Thank you for sharing that.
Awesome. I'm so excited to see so many people here that are just motivated to have these kinds of talks and interactions. My closing is that what I feel we need is a shared dream, and we're getting closer to that point, but we're not there yet. And I dropped a link in the chat to one of my favorite thinkers, Donella Meadows. She's kind of one of the god founders of systems thinking, and I think for system transformation, incredibly important figure. And this outlines leverage points where you can intervene in a system for change. And the most powerful place is paradigm, which is like kind of the overriding consciousness that the system comes from. So I challenge all of us to think about what is that shared dream that we can come up with, because it's not whether healthcare is a right or a privilege. Like, we don't even all agree about that. It's not about Medicare for all or not. That's not what the shared dream is. But there is a shared dream somewhere in these conversations. And if we can figure out what that is and turn it into a social movement, that is going to be powerful. So that's, I guess, where I want to leave it.
What a beautiful way to do that, Gabe. Thank you.